A very good morning, dear students. Today in this video lecture, we are going to study about food poisoning, worms infestation, and diarrheal disease. This is the second installment of our intestinal infections subtopic. So let's continue with food poisoning. Now, what is food poisoning? Food poisoning, we can also say foodborne illness, is basically caused by eating contaminated food, or we can say the general definition to it is illness caused by infection with microorganisms and ingestion of toxicants produced and chemical poisoning. Now, what are its causes? Now, bacteria and their toxicants, that is viruses, chemicals, and vegetable poison. Food contaminated with pathogenic microorganisms usually do not look bad, taste bad, or smell bad. It is impossible to determine whether a food is contaminated with pathogenic microorganisms without microbiological testing. Now, the classification of foodborne disease. We can classify them into two parts, that is foodborne infection and foodborne intoxicants. Foodborne infection is caused by the ingestion of food containing live bacteria which grows and establish themselves in the human intestinal tract. Foodborne intoxicant is caused by ingesting food containing toxins formed by bacteria which resulted from the bacterial growth in the food items. The live microorganism does not have to be consumed. Foodborne infection. These can either be bacterial, viral, and parasitic. Foodborne infections tends to have long incubation periods and are usually characterized by fever. Bacterial foodborne infection. Bacteria are the most troublesome and important biological foodborne hazard for the food service and food retail establishment. Bacterial cell can exist in two different states, the vegetative state and the spore state. Spores are produced when the bacterial cell is in an environment where it cannot grow. Frozen food, dried food. Now let's talk about E. coli. That is Escherichia coli. Is the group of bacteria includes 4 strains of foodborne pathogens: enterotoxigenic E. coli, enteropathogenic E. coli, enterohemorrhagic E. coli, and enteroinvasive E. coli. The most important of the group is a particular type of enterohemorrhagic E. coli called E. coli O157 ratio 87. Illness can be due to an infection and a toxico infection. Illness due to E. coli 0157 ratio 87 is particularly serious in infants because it can cause kidney failure and bloody diarrhea. Now common foods. This microorganism has been isolated from the raw milk and raw ground beef. Transmission in food. E. coli is usually transferred to food like beef by contact with the intestine of animal. Transmission can also occur if employees are carriers and do not wash their hand properly after going to bathroom. Prevention. Cook hamburger patties until well done or until all the juices run clear. Do not use raw milk product. Make sure that employees practice good personal hygiene. Salmonella space. Description. Salmonella is facultative anaerobic bacterium that frequently causes a foodborne infection. Like E. coli, the source of salmonella is the intestinal tract of worms, bloody animal. Common foods. This microorganism exists in many foods, especially raw meat and poultry products. Eggs, milk, dairy products, pork, milk chocolate, and cream-filled desserts. Transmission in food. Prevention. Wait a minute. Now let's talk transmission in food. Since the microorganism exists in many raw seafood, transmission to food, other food by cross contamination is a concern. Most illnesses are caused due to eating raw or uncooked seafood, especially oysters. Now the prevention is cook seafood properly, avoid consumption of raw seafood, and practice good personal hygiene. Now, what are the symptoms? I am talking about all the infections. Till now, we have studied about different microorganisms like E. coli and all. Now, the symptoms that are common to all are nausea, vomiting, watery or bloody diarrhea, abdominal pains, and cramps. Signs and symptoms may start within hours after eating the contaminated food, or they may begin day or even later. Sickness caused by food poisoning generally lasts from a few hours to several days. Okay. So that's all for food poisoning. Now, if we have to talk about next point, that is okay. Now let's talk about diarrheal disease. Diarrhea is derived from Greek word meaning flowing through. It is the second leading cause of death in children under 5 years of age. Now, according to World Health Organization, diarrhea is defined as passage of 3 or more loose stool per day or passing more stool than normal for the age. Incidence every year, there are about 1.5 to 2 billion deaths of diarrheal disease occur. Diarrhea is the second leading cause of child mortality and morbidity in the world. 1 in every 5 children dies of diarrhea every year in India. And it's mostly due to contaminated food and water sources. Now, if we have to classify them, we can classify them on the basis of duration. It's acute and chronic. And if we have to classify it on the basis of clinical presentation, then it's acute watery diarrhea, and acute bloody diarrhea. And if we have to classify it on the basis of physiology, then it's secretory diarrhea, osmotic diarrhea, exudation diarrhea, motility related, and inflammatory diarrhea. Now about etiology. The causes of diarrhea are as following: infection, drugs, dietary causes, surgical condition, miscellaneous causes. Now, what are the physiological disturbance in diarrhea? Now, if diarrhea occurs, there is basically loss of normal alkaline secretions and fluid as they get out of the body, and that ultimately results in dehydration. Also, there is metabolic acidosis as the alkaline content is becomes less, which further leads to inflammation and edema of mucosal membrane, which leads to chronic diarrhea. The fluid loss and carbohydrates increases, which leads in increased bacterial growth and release of organic acid, that ultimately results in poor nutritional status. If we have to talk about the clinical feature and assessment, clinical feature of diarrhea depends on its severity. Mild diarrhea, basically 2 to 5 loose stool. Moderate is 10 or more loose stools, and severe diarrhea is hundreds loose stools within 24 hours. Diagnostic evaluation, we can take the history of the patient, physical examinations, and stool examination, stool culture, and blood tests. Now, how can we manage it? Management of infant and young children with diarrhea and dehydration. Focus on replacements of the fluids, administration of prescribed drugs, maintenance of nutritional status, and educate the mother regarding prevention of diarrhea. Thank you. That's all for management of diarrheal disease. We will further proceed on worms infestations. Worms infestations are long-term disease that produce few symptoms in their early stages and sometimes serious effects at well-developed stages, or may be quite fatal at times. Children often complain of stomach ache. One of the leading cause of stomach ache in the children is intestinal infection, which is mostly caused by intestinal parasites such as worms. Worms tends to live in the intestines and feed off your children's nutrition. There are different types of intestinal worms that can now the worms tends to live in the intestine and feed off your child's nutrition. There are different types of intestinal worms that can cause worm infection, but the most common are tapeworm, roundworm, pinworm, threadworm, and hookworm. Worms infestations are related infections, are common in children, and are also easily treated. Okay, now causative agents we have already discussed. Let's move on. After etiology, you will get them of the PDF. Now about the causes. The causes, as children are quite dynamic and active, they tend to come in contact with germs easily. Some of the causes of worm infections includes coming in contact with infected surface such as soil containing eggs or germs at a playground, or touching pets infected with worms. consuming infected foods or water, improper hygiene, inadequate hand washing. ठीक है. Now regarding the symptoms. Now symptoms of worm infection are irritability, weight loss, stomachache, bad wetting, and blood stool. Besides these, each worm infection has distinct symptoms as listed below. That is for hookworm, it's abdominal pain, colic, that is cramping and excessive crying, intestinal cramps, nausea, fever, blood in your stool, appetite loss, itchy rash, and if we talk about ascaris, it's nausea, vomiting, irregular stools, visible wounds in the stool, stomach or abdominal pain, and weight loss. If we talk about pinworm, that is frequent and strong itching of the anal area, restless sleep due to the itching and discomfort, pain, rash, or other skin irritations around the anus, the presence of pinworms in the area of your child's anus, the presence of pinworms in stool, whipworm, bloody diarrhea, painful or frequent defecation, abdominal pain, nausea, vomiting, headache, sudden and unexpected weight loss, fecal inconsistency, or the inability to control defecation. Tapeworm, pain, unexplained weight loss, blockage of the intestine, and digestive problems. That's all for the intestinal infections. In the next lecture, we are going to talk about arthropod bone infections.